I have mentioned several times yesterday and last year also the ASTER task force, which is, so while Alex is downloading the presentation. So ASTER is what he called industry-driven initiative on emerging and smart technologies for healthcare. This is an initiative started 2 years ago by, this is a joint initiative between the European Commission and the medtech industry, represented by Serge and his members and his associations, to address, let's say, the challenges of translation of innovation to the market in healthcare and in health tech. And why nanomedicine has been approached, let's say, by DG RTD 2 years ago. And so Eiko, who is representing DG RTD today, was already there 2 years ago, is because, let's say, in the small area of nanomedicine compared to the wide area of health tech in general, we have demonstrated, I mean, ETPN has demonstrated, thanks to this Nanomed translation hub, our capacity to understand, let's say, the bottlenecks in the translation and in the value chain, and to develop the necessary instruments to overpass these bottlenecks. So basically the initial request from the Commission was to, okay, please do the same in health tech and not only in nanomedicine. And this is basically the initial request about ASTER. Does it work? Yes. So just to remind you, though, of course, I will not bother you, let's say, with political priorities. However, these priorities are important, and you will hear about them in the coming months. Of course, you know that the Europe as a whole has, let's say, to address, let's say, so many priorities, which are not only science-related at the moment. So it is the only opportunity, let's say, to initiate a European-wide initiative is to let's say, put your initiative in the mainstream of priorities. And then I would just name here a few of these priorities. Of course, President Juncker, President of the European Commission, has identified several priorities listed here. And then Commissioner Moedas, Commissioner for Science, Research and Innovation, has added his 3 O's for open innovation, open science, and openness to the world. And finally, the new Commissioner Gabriel for ICT has added, let's say, the priorities on digitization of society and the digital single market. So basically, these 3 levels of priorities are defining a space where we have to develop, let's say, innovation in health tech, and this is the space where nanomedicine has to develop. And we have conducted, let's say, I don't know how many interviews, maybe hundreds of interviews, interviewing, let's say, entrepreneurs, regulators, TT offices, technology providers, patients, and so on, to identify, let's say, the most urgent bottlenecks and the major challenges we have to address in health tech. And these are, of course, not all, but the major challenges in health tech for the coming years. First, Europe, in order to compete, let's say, with other regions of the world, has to focus, let's say, on products with a higher value. And most of these products are combining technologies to offer, let's say, some superior technical features. And so these products usually are combining different technologies, and it comes back to this cross-key enabling technologies approach. Second challenge is the new regulatory framework. You know that last May, Europe has adopted 2 new directives on medical device regulation and IVD test regulation, which will revisit in depth the regulation for approving and for certifying these devices and these technologies. And so it will have a major impact due to the rise of, let's say, safety and clinical requirements. So it will have an impact in terms of cost, development time, and so on. Third point is, obviously, it looks like a buzzword, but digitization of healthcare. And, well, we already look around us, let's say, some examples on how IT technologies and digitization is impacting our everyday life, but it is also the case in healthcare. Even though healthcare is at the moment, let's say, not as is impacted as it will be, because for the moment the wellness sector, which is a non-regulated sector, is much more impacted. I'm sure you have your iWatch, your apps and so on. And because healthcare is heavily regulated, it's a slower uptake of the IT technologies. And finally, the new business models. By new business models, I mean you don't have, let's say, the old classification with a pharma company, biotech company, medical device company, and so on. No, the borders among them are just exploding because pharma companies are developing technologies, IT companies are entering the healthcare area, and so on. So the old classification doesn't work anymore. And so we have identified 3 major large-scale initiatives in healthcare. The first one is IMI, standing for Innovative Medicine Initiative, which is a joint undertaking between the European Commission and the pharma industry. And this large-scale initiative is addressing the development of innovative medicines and trying to shorten the development time by 2 years of this medicine. So I think several people mentioned yesterday this IMI initiative, and I will refer to it. So it's a strong focus on pharma and drug development. The second initiative, which is more recent, is the EIT Health, so the European Institute of Technology. And the opposite, this one is, let's say, non-domain specific, not specifically pharma, not specifically IVD or medical devices, but it's focusing, let's say, on the market access, to at the very high TRL, 8 or 9, so they try to speed up, let's say, the market access. They are not investing, let's say, into the lower TRLs, like 4 to 7. And finally, Aster is, let's say, in the empty space, in terms of TRL from 4 to 7, or 4 to 7, and in terms of let's say industry, medtech, compared to a pharma industry or to biotech industry. And the 4 objectives, the future objectives of Aster, are first to maintain the competitiveness of the health tech, European health tech industry, despite, I would say, the changing regulatory environment, which will impact this sector, as I said. Also to have a special support on SMEs, to not only, let's say, for research and development, because EC has invested a lot under FP7 and Horizon 2020 on research and development projects, but to bring the results of these projects up to the market. Because, let's say, citizens don't care, let's say, if, let's say, the academy or a research organization have been funded. They look for solutions, healthcare solutions. So we have to bring, let's say, the innovation to the market, so from early research, development, and innovation to the market. Then the third objective is to deliver value-based healthcare solutions with an outcome-based payment. So this is a totally different perspectives. It's not, let's say, the cheapest technical solutions which will be adopted later on, but the devices or healthcare solutions provider will have to demonstrate the value added by their technology or by their product. And as, let's say, technology developers or providers, we also have to think along the same lines as Serge mentioned in his introduction. And of course, leveraging the vision on health tech. And I must say that, pharma has been very good and really excellent in, let's say, in being visible and in the mind of very many people, healthcare means pharma, means IMI. So basically the medtech industry, which is as big as the semiconductor industry in Europe, with 120 billion euro turnover per year, is under the radar, which is strange to some extent. So how did we started to work together? So we started, let's say, 2 years ago, and first we have a lot of mapping exercise and networking, trying to understand, let's say, the full value chain of health tech. And so we have conducted interviews and so on. And basically we didn't, let's say, initiate activities, we have established a task force, you will see later on, to make this early networking and mapping exercise. So now we are, let's say, in the late 2017, and we will start some actions. So Nobel, as you can see, is listed here, but some other projects, funded projects addressing, let's say, the combination of key enabling technologies for healthcare will start in the coming months under work program 2018 to 2020. And basically, then we have a new. We have a new horizon. Is here under FP9, and there we have, let's say, a blank sheet, and we have to propose to the European Commission, let's say, a plan, a mission for health tech and innovation in health tech under FP9. And for doing that, there again, this is not, ESTER is not, let's say, another initiative to support early research and development. This is, let's say, a holistic approach of the whole value chain. And for doing that, we have, let's say, identified partners or stakeholders all along the value chain, starting, let's say, from basic research to the patient. And sometimes even it should be illustrated like a loop. So it took us, let's say, a lot of time to identify, let's say, the relevant partners, especially in Europe, where you know that healthcare is a national policy, not a European one. So it means that we don't have, let's say, one single healthcare system in Europe, but 28 or 27 or 26, I don't know. Anyway, so also ESTER will probably evolve as an association now, just to have a legal form, but this is just, let's say, a legal decision. And what is important to notice is that so we started with a task force, so with let's say advisors, ad hoc advisors, mostly coming from industry. We have interacted, and we still interact a lot with many different units from the European Commission, and we have a core working group working every day, every week on improving the definition of ESTER. And we are seconded, let's say, by different working groups we have established so far. So the technology providers here, the clusters and the regions which are supporting, let's say, locally their medtech industry, hospitals and key opinion leaders in clinical centers, public procurers for innovation, HTA agency, and so on and so on. The technology platforms, and ETPN is part of this, with APOS, Photonix21, EUMAT, and ESB, and so on. And of course, industry is in the center with the large multinational companies and the national trade associations in medtech. And just to give you some examples, these are some of the industrial participants, or I should update this, so you can see that I have listed here only the large companies, because the small companies, we don't have, let's say, a full list of full companies for the moment. But so we have, I think, Serge, I don't know if it is for the first time, but at least having MedTech Europe, FPR and COSIR at the same table is a significant step forward. Having, he agrees. And then what is quite interesting is that we have a strong commitment of regions and clusters, because they really want to get support from ESTER in helping them implementing support to the medtech and healthcare industry. So this is just, there again, these groups are not closed club. That means it's open, and so if your region has identified, let's say, support to health tech or to the personalized medicine development is interested, please tell me. And we have the group of our research and technology organizations, so some of them are present here today, because these people are interacting every day with SMEs on one side, clinical centers, regulators, so they are used to innovation in this space. And so we have identified here, or you don't have to read, let's say, all the text, but let's say we have identified, let's say, some items on which we will have to address, to initiate, let's say, some programs, initiatives, infrastructures to overpass, let's say, each of these topics or bottlenecks previously identified. And what is the tentative timing? So we didn't start it, let's say, a totally new initiative like IMI, like the joint undertaking, because first it takes enormous time, let's say, to set up such a large initiative, especially if you mix, let's say, public funding, private funding, national funding. So it's a big mess. And the feedback we've got, let's say, either from IMI or from Excel in microelectronics is that, okay, don't do it again because it's so messy that you have to find, let's say, a more flexible or more agile organization. So basically, until the end of the Horizon 2020 program, we are establishing Esther and its different activities step by step, so that at the end of Horizon 2020, we have to be, let's say, fully operational for the new framework program. And as I mentioned yesterday, we don't know how FP9 will look like, but it means during this phase, we have to remain, let's say, very agile, very reactive, so that we can mobilize the necessary resources to be ready for FP9. And with that, I will end my presentation with these 3 take-home messages. First, Esther is not, let's say, another initiative to support early research and development, but it's a holistic approach to support the medtech industry, covering, let's say, not only nanomedicine, but let's say all technologies for healthcare, and also it's not, let's say, a technology push approach, as mentioned by Serge, but it's more, let's say, a holistic view of, let's say, what are the societal needs, what are the capacities of industry to develop these products, and then what are the necessary techniques they would need for reaching their goals. Second message is that we combine actions all along the value chain, which is quite demanding because it's not as the usual way as we are used to do, let's say, to work, let's say, scientists with scientists or scientists with industry. We have to invite much more people who are not used to talk to or to work with. So it is very challenging, but it is really a fantastic challenge because then you discover a full world of new opportunities. And of course, we have a special attention to the SMEs, startup and SMEs, because this is, or as you can see from some of the presentations we had today and we will have tomorrow, you can see that these SMEs and startups are really a reservoir for growth and jobs. So this is why we have to help them. And basically, there are, let's say, the companies which are, let's say, the preferred target because they need public support in their development. With that, I think I will finish my presentation, and I thank you very much for your attention. If you have one question or half a question, it's okay regarding time. Thank you very much.